do you see some sort of grinding patterns of your teeth that can show sleep apnea indications? That's what dentists look for. The dentists that I train, I tell them, look for lower anterior wear, the front teeth grinding, because the patient or the person's doing some anterior movement of their jaw, bringing their jaw forward, really creating their own mandibular advancement. These things, we look in the mouth already for gum disease, for oral cancer, for cavities. Why not look for sleep as well and just bring up the conversation? Hey, Tim, how well do you sleep at night? Does anyone tell you that you snore?